The prescription for OxyContin, which Jordan was given for a soft tissue back injury, changed his behavior in many ways. The drug, after a few weeks, and when he was firmly into what I believe was firmly into addiction, made it so that he was, when he was on the drug, he was cheerful, he was calm, he was happy, he was working and focused. But when he started to come down from the drug, he became cranky, annoyed, out of focus, disrespectful. There was a 180 change in his behavior. How did it affect the quality of his life? It took away the joy, really. He had his own business that he started at a young age. The business became less and less important until finally, after about 8 months of addiction, it faded right away. He became totally focused on getting OxyContin, and it was he lost friends, he lost a lot of self-respect, I think, and it was there was nothing good about it. I believe the doctor did not notice the problem until Jordan came to him and told him that he had a problem with addiction. The doctor's response was anger. He was angry and disrespectful to Jordan when Jordan was coming to him telling him he was addicted and wanted to get off the drug and needed to go into detox. I noticed the problem early on because I saw a behavioral change. He's my only child, Jordan, and so I was focused very, very squarely on him. So I noticed the erratic behavior very quickly. The doctor was not versed in recovery, so he actually fired Jordan as a patient as a consequence of Jordan telling him that he was addicted to the OxyContin. There were no resources provided to Jordan by the doctor, none. The doctor basically kicked him out of his office. After that, Jordan came to us and said that he wanted to go into detox. We did find a detox facility in our area. Jordan was accepted into that program after he had come down in the amount that he was taking. We found that on our own. Jordan's demise really was from lack of resources after detox. Jordan went through a tremendously painful and just awful withdrawal for about 2 months after detox. We could find no counseling. We could find no doctor that could prescribe Suboxone, which we both knew about as a drug that can soften the effects of withdrawal and help a person actually recover. We could not find that. I could not find a psychiatrist that was versed in addictions. So essentially, we had no support. Jordan did relapse after about 2.5 months. He took a combination of drugs that were street drugs and prescription drugs, which stopped his heart. And that was the end of that part of the story. I would tell people families and patients who are being prescribed opioids as pain control to do their research. People need to know the dangers of opioids. It is a fine drug used in the right way. I mean, people have chronic pain, they have critical pain, and they need relief. There's no question. But doctors need to tell patients, patients need to ask, and families need to ask, what are the dangers of this drug? How do we make sure that nothing goes wrong in the using of this drug? Information is what I would say people need across the board for any drug, but in particular addictive drugs, opioids. The message that I would like to relay to primary care providers is almost the same. You need to know that opioids are dangerous, potentially dangerous drugs. They are so dangerous that people die from the medicine instead of from their ailment. I believe also that doctors need to surveil and monitor patients closely who are taking opioids. Know when that critical point is, when addiction is happening. Sometimes the patient doesn't realize, if they haven't taken opioids before, that addiction is happening right there in their body. There needs to be surveillance, and there needs to be also, I would say to doctors, even before prescribing opioids to a patient, know that this person may or may not be susceptible to addiction. I just hope doctors are careful and also versed in addiction and versed in recovery if they're going to use these drugs for pain control.